Good day, Game Jammers. I am Dr. Ken Dominguez, medical epidemiologist at CDC.
Hello, I'm Dr. Jessie Legros, Senior Public Health Educator, also at CDC. Thank you for the opportunity to speak with you on the unequal burden of COVID-19 diseases and death of certain racial and ethnic populations. According to data from the CDC, we know that certain racial and ethnic populations, African Americans, Hispanic Americans, American Indians, and Alaska Native persons, as well as the elderly and those with certain health conditions such as obesity, hypertension, and diabetes, are bearing the burden of infections and death. In addition, social determinants of health, such as lack of health insurance, low educational attainment, limited English proficiency, crowded housing, racism, and ethnic discrimination, have historically prevented racial and ethnic populations from having fair opportunities for economic, physical, and emotional health.
So what can we do to overcome some of these barriers? The main strategies for preventing and mitigating COVID-19 in communities include use of masks, social distancing, hand washing, COVID-19 testing, isolation, quarantining, and contact tracing. Social determinants of health can serve as barriers and facilitators to each of these strategies. Remember that persons are asked to quarantine if they recently had close contact with someone with COVID-19 or may have been exposed to COVID-19 or who may have recently traveled from a place with ongoing community spread. Persons are asked to isolate themselves for at least 10 days if they have or think they might have COVID-19. So we're going to describe each strategy and then describe potential social determinants that serve as barriers, and then some suggested strategies to overcome these social determinants of health.
So for COVID-19 testing as a strategy, some barriers: lack of access to testing due to costs or lack of health insurance, inconvenient locations or scheduling of testing services, lack of testing staff who can communicate in the same language as that spoken by the clients. And some facilitators include low cost of free testing services. Free testing would likely result in better access. Drive-through testing or walk-up testing accessible by public transportation or car. The latter would provide better access for all. And a third facilitator for COVID-19 testing would be testing during routine business hours or additional testing during evening and weekend hours, so that expanded testing hours and days would provide for better access. A final facilitator for COVID-19 testing would be hiring staff who are representative of the community and who speak the same language to assist with testing services, including reporting of results.
So what about isolation or quarantine? What are the barriers for those? So some examples are living in crowded housing or having multi-generational families or household members with chronic underlying conditions that put them at risk for severe complications of COVID-19 infection. Not having access to specific alternate isolation or quarantine facilities outside of the household, that could be another one. Also, reluctance to isolate or quarantine outside the home due to fear of separation from the rest of the family or other reasons. So how do we overcome those barriers? So some facilitators include educating the community about the importance of isolation and quarantining and how it can protect themselves and their families, particularly those most likely to experience severe complications from COVID-19. We can also recommend persons in crowded housing who sleep in the same bed or bedroom sleep head to toe or place partitions such as shower curtains or other plastic barriers between the persons to maintain social distance between the beds. Providing hoteling options, which allow clients to isolate away from family if needed, or which allow clients and their families to live away from home during the required period. Also, as a part of hoteling options, we can provide free food and other needed services such as close monitoring of symptoms for those who are isolating or quarantining. And so, for example, the types of hotel options that include options for both patient and family and the provision of food and other services would be much more effective than simply just recommending toe-to-head sleeping and use of plastic partitions. Finally, posting testimonials on social media from patients about good experiences with hoteling outside of the household might help destigmatize such mitigation interventions.
So what are some barriers for contact tracing and what are some facilitators that can be used? So barriers, for example, would be stigma with sharing accurate contact information with public health authorities due to fear about how that information would be used. And a few facilitators are as follows: educating patients about the purpose of contact tracing and importance of sharing accurate information so that patients, families, and other community members can be protected from COVID-19 or quarantined and monitored for symptoms. A second facilitator would be hiring staff that are representative of the community who are culturally aware and able to adequately communicate. For example, multilingual staff who would serve as contact tracers. And also posting testimonial on social media from patients about good experiences with contact tracing would also help destigmatize this mitigation intervention.
So we've just shared some information about specific strategies, including the barriers and facilitators for a number of intervention strategies. The CDC website also provides suggested actions for various types of providers. So if you enter the word CDC coronavirus, what we can do in your browser, you can access this information that we're going to be sharing. And so we'd like to share some sort of examples of actions that various players can take. So for example, if the player is a community and faith-based organization, what can they do? So an example would be they can work with trusted local media, such as local or community newspapers, radio, TV, to share information and language suitable for diverse audiences. What about employers? What can they do? They can provide masks, hand sanitizer, hand washing stations, and personal protective equipment as appropriate. What about healthcare delivery systems in general? They can increase engagement with trusted community and faith-based organizations and institutions that have relationships with local communities. And finally, public health agencies, what can they do? They can build partnerships with tribes, scientific researchers, professional organizations, racial and ethnic minority serving organizations, community organizations, and community members to share information and collaborate to prevent COVID-19 in communities. So Game Jam participants, when developing your scenarios, please consider including a variety of racial and ethnic groups, including those working in frontline occupations, such as meat processing or farm work, that are most highly impacted by COVID-19, and provide various interventions of varying effectiveness in the toolbox. And remember to reward gamers for choosing a combination of mitigation strategies that best address social determinants that prevent communities from implementing mitigation strategies. Also, consider putting gamers in the shoes of various providers who are charged with helping communities navigate the COVID-19 pandemic. For reference purposes, the script for this chat will be made available to gamers through the Game Jam organizers. Thanks so much for your attention.
Thank you.